Good afternoon, everybody. How you doing? Everybody all right?
Great.
Thank you for coming out for the Trump Tuesdays, talking about these issues that impact us nationally, but more importantly, how they affect us all locally. And trying to get involved and get a conversation going, get interaction going. Today we're talking about health care, and I'd just like to echo the words of Elizabeth Warren about how incredibly difficult health care is. And it's not an easy thing. And they said even when they pass legislation, they have to come back a few weeks later and talk about improvements that need to be made. So when it was said that no one knew healthcare was a complicated issue, I think that's not a common consensus for people who have worked on it for many years. It's quite a complicated issue, and we've got some people here today that are in the front lines of the healthcare battle that have fought for it their whole lives, and we're going to hear some words. Our first speaker will be one of my friends, a neighbor down the street, Peggy Chase.
All right.
Hi, thank you all for coming today, and thank the rain for staying away. I'm a registered nurse for over 40 years. I've seen a lot of changes in healthcare, not always for the good. And when I first started practicing, you would get what you needed, and then the insurance company or Medicaid or whatever would be able to be billed, and they would just pay the organization. As things went on, it got to the point where what they did is they put you in a little box. So if you had a fractured hip, it didn't matter what they did to you, you got X number of dollars, which started impacting on the hospitals, the nursing homes, physicians. Then as it has gone on, it has gotten really worse and worse to the point where the insurance companies are the ones that are really having the last say on your health care. I know a lot of my friends, when they had enough of clinical work and they were getting a little worn down, a lot of them, they would go to insurance companies thinking that now they would be able to help. And when things came in about people needing services, they would be able to say, okay, you can have the service. Many of them have pulled out because they have been pressured so much to deny services that, being a nurse, that's just not where we are. After I kind of retired, I have had the opportunity to volunteer at a free clinic. And I've got to tell you, that's one of the most rewarding things. You would think that the free clinic is for people that are like homeless, your street people. Those are not the people that we see. We see a lot of people who have jobs, who can't afford health care. They have families. It's between feeding their families and paying for health care. And so they end up at the free clinics. The free clinics are able to, as long as you don't have any insurance, provide some preventive care, some disease management, but we certainly don't have the resources that we need. But it's our little way of being able to at least provide some kind of health care, because even though people talk about the price of health care, when you look at not getting preventive care, that only ups the price of health care, because people do not show up in their emergency rooms or doctor's offices until they are really out of control sick. So anything we can do to make this better, I really appreciate everybody being supportive of this. It's an ongoing struggle to be able to provide good health care to everyone, because as the sign says, health care is a human right. Thank you.
Great words from Peggy Chase. Yeah, just what Peggy said about preventative health care. I lost a close friend last year because of exactly that. She had a rare form of cancer. She started feeling ill. She started feeling tired. But she didn't go to the doctors for months because she didn't have any coverage. And if she was really ill, she was terrified of what that would mean for her and her family going bankrupt. by the time they caught the cancer, it was too far progressed to deal with. So I think we're also talking about we pay for this stuff one way or another, through losses that come later, or if we deal with it up front. So I think, when we're paying for emergency rooms, it's not like the healthcare is free. You're paying for it still if you're paying for emergency rooms and other things that aren't being covered. It's just economically makes more sense to do it preventatively than to worry about things after they've gotten to a point where you can no longer contain them, and you have to address the issues when it's in a crisis state. So I'm glad to see you all out here. I hope we can keep the fight going. Mary-Ann Millar? Yeah? Our next speaker is Mary-Ann Millar. She's been working in the health field for a long time with women's health.
Yeah, I'm a gynecologist.
Well, she's a gynecologist working with women's health. And an issue that's very important to all of us. So please welcome Mary-Ann.
Well, thank you so much. It is such an honor to be here today. So yes, I am a gynecologist. I practice at Community Hospital. What I'm speaking on today are my own opinions. So healthcare is not a privilege. A privilege might be living in a penthouse on Fifth Avenue, or going to Florida every weekend to play golf on the taxpayer dollar. That's a privilege. Healthcare is a right, a human right. And, healthcare should really be available to all citizens. So we have now programs Medicare and Medicaid, and Obamacare is now starting to fill in the blanks, but we need to even go further. So with Obamacare, it has increased the number of people that are insured, and women that have breast cancer, if they are uninsured, they have a 50% chance higher of dying than a woman that's insured. Women that are pregnant that don't have health insurance, they have worse outcomes than women that are insured. So this is very important. So what Obamacare has done is that it's given us protections that we haven't had before, not just increasing the number of people who are insured, but also protections for people that were already insured or maybe underinsured. So some of those things that we're familiar with are not discriminating against people that have had pre-existing conditions, being able to keep children in our families that are younger than 26 on their parents' insurance. And especially in the last number of years with the economy being so bad, these young people have had a really tough time getting jobs, and also, and if they don't have jobs, then obviously where are they going to get their health insurance from? Another issue had been the lifetime maximum for insurance coverage. Like, it used to be like $1 million for a lifetime, so that you think that's a lot of money. But if you're a family that has a disabled child or a cancer diagnosis and you need some kind of special chemotherapy or experimental care, $1 million goes really fast with the price of healthcare these days. So that's important. As a gynecologist, another really important part of the Obamacare has been coverage of contraception at 100% without any copays. And what we've seen since that's been in effect is that the number of abortions has decreased significantly since it's almost at the same level as before Roe versus Wade. And keeping in mind that abortion is still legal in this country. Also, teen pregnancies have decreased significantly. In New York State, Onondaga County actually has one of the lowest rates of teen pregnancies, and that's thanks to the availability of contraception without copays. So if the goal is to prevent abortions, contraception is the way to go. Abstinence only, sex education does not work.
Right.
So then came along the repeal and replace that came along. So the Republicans for 7 years have had an opportunity to try and figure out how are they going to repeal and replace Obamacare. They're really good at repeal, but they're not so good at replace. And so what happened is that they came up with this tax credit change so that instead of being based on need, it's being based on age. And so an older person gets more of a tax credit, and you would think, wow, that's great, but it's really not. Because what happened is then insurance companies can now charge older people more for their insurance, so it becomes a net loss. Defunding Planned Parenthood. For some reason, they decided that they're going to defund clinics that get Title X funding, which Planned Parenthood is one. But just for a year, so we'll see how that goes, and then maybe we can defund it for a second year and a third year, and then maybe forever. And just to be clear, what defunding Planned Parenthood means is it's not like the government has this big pot of money that they give to Planned Parenthood. It's paying for services rendered. So Planned Parenthood, They do 3% of their business is abortion. Again, it's legal, and no federal dollars. The Hyde Amendment that came out of some bad legislation in the past does not allow the government to pay for any abortion. So Planned Parenthood provides contraception, cancer screening, and now I believe they're starting to see men as well. Is that correct?
Yeah, we've been.
Yeah, so they see men too. So defunding Planned Parenthood is a big deal, and it leaves a lot of women and men vulnerable and without coverage. So that would have been really, really bad. Let's see. Also, what it also did, I forgot to mention before, that Obamacare put into place also, is the essential benefit package that any insurance has to provide: maternity care, hospitalization coverage, mental health care, the contraception, all of these things. And so because the Republicans couldn't get enough votes for their Trump care bill, in order to bring the right of the right in, they said, well, okay, we'll get rid of those essential benefits. And even that wasn't draconian enough for them. So the bill didn't pass, and here we are. One thing I would like to say, to give credit where credit is due, is I really do want to thank Representative Katko, because he's been a no vote for this. And I've been calling his office quite a bit, and I called them a couple of hours before the vote was supposed to go in on Friday, and he was still a no. So, thank you to Representative Katko, and hopefully as we go forward and Republicans try and do more things to the Affordable Care Act, he will still remain on our side, on the side of the major stakeholders, which are us, for health care. So we have this victory, but we have to keep at it. We don't know what's going to happen next. And I just want to close by saying every American has the right to accessible, high-quality, affordable health care. Thank you.
Excellent. Thank you all. Our final speaker, Stephanie Phillips, coming here from Planned Parenthood. Yes? Planned Parenthood doing so much great work, and as she said, it's 3% abortions. The rest is screening people for very dangerous forms of cancer, and doing a lot of work for health all around. So defunding it is an illogical step. So let's welcome Stephanie Phillips here from Planned Parenthood.
Hi, everybody. I'm Stephanie. I'm the health center manager at Planned Parenthood Syracuse. Forgive me, my fingers are freezing. I want to talk a little bit about what the Affordable Care Act has meant for patients right here in Syracuse. First, though, I want to thank everybody here, everyone in Syracuse who called your representatives, who turned out for marches. This was really your win, right? This was your win. You made your voices heard. You said, you cannot take this away from us. This was all of us. 4,500 patients come through my clinic's doors every year. So that little clinic up on Genesee Street, we're seeing 4,500 Syracusans every single year. 73% of them live at or below the federal poverty level. 63% of them don't have any other health care whatsoever. What the Affordable Care Act has meant for my patients is that they don't have to worry about the financial burden. When they come through those doors, we're able to say to them, hey, New York State did Medicaid expansion. You actually qualify for Medicaid, even though you're working full time, even though you have children you support, you can still get this help. The other thing it's done is made contraceptive access really, really easy, especially for young people, so important. And as a result, we're seeing 30-year lows in the unintended pregnancy rate. The only indicator for the number of abortions that will be done in any given country, any given state, any given county, is the unintended pregnancy rate. That's it. That is the only indicator. Legality doesn't matter, only whether or not people are having pregnancies that they did not intend to have. So, at Planned Parenthood, we talk a little bit about defunding and what that means. And I think it's a little bit of a misnomer, because what they're really talking about is cutting off access to Planned Parenthood services and to Planned Parenthood seeking reimbursement for services rendered. Medicaid patients have provider choice. They have a right to be able to go to any provider that accepts Medicaid. And we already have a shortage of providers that accept Medicaid, so it fundamentally doesn't make much sense to exclude an entire practice who is willing and able to take Medicaid patients and provide such a vital service to the community. The other thing I want to talk about a little is all of the non-insurance thing the Affordable Care Act is doing. We focus a lot on insurance coverage and what that means for access, but if you don't work in healthcare policy or if you don't work in healthcare administration, you might not know about the other things that are going on behind the scenes in the background. The Affordable Care Act is revolutionizing the way that we provide care. It's making us look at our extant health systems and say, where are people falling through the cracks? The ED is a perfect example. People go there when they don't really need emergency care. And then all of that cost gets shifted back to us or shifted back onto hospitals, and then we end up paying for it anyway. So the Affordable Care Act is telling us, why don't we look at community-based healthcare? Why don't we try to put patients where they need to go? Give them appropriate referrals, make sure that the referrals are followed up on. All of that is being discussed in the context of the Affordable Care Act. So insurance is important. I've heard a lot about how insurance doesn't mean healthcare or that it's like car insurance, but it's not. Insurance means access. If you can't pay, then you can't get the care you need. People do not go to the doctor when they need to because they're afraid. Before the Affordable Care Act, and it seems crazy because that was not that long ago, people were being bankrupted by their medical bills. That was a reality for millions of people across the country. It was a reality for us here. So I think I'm so happy that we're in this place. We are able to move forward. But I want to say that the fight is not over. There are so many fundamental misunderstandings about how the healthcare system works. It's complicated. And there is, who would have thought? I know, me. There's a lot of focus on just the insurance piece when really the ACA is doing so much more. So I really encourage you, when you're having these conversations with people you know, with your loved ones, really delve into what the ACA is really doing. Ask somebody who works in healthcare administration, how has your job changed since the ACA came around? Because it made a huge difference for all of us, and it made a huge difference for all of our patients. Thank you.
Thanks so much to Stephanie and all the other people who spoke today. If I could just say a few things. The Reverend Barber, who spoke at the Democratic National Convention, said that these are not Democratic issues, these are not Republican issues, these are not conservative or liberal issues, these are human moral issues. Helping out someone who's sick is the basis of all Judeo-Christian religions. It's helping people when they're down, and that's who are we as a society, is what we have to ask ourselves. And I would like to say, as someone who's lived in England, I lived in England for a decade, a little more, and I can tell you that single-payer systems do work. English people love them. It works great for them in England. What's that? Yeah, I'm aware. It's America. Big fan. So in England, it works great. And all of America we are in America. My friend here is right, we are in America, and America happens to be the only industrialized country in the entire world that denies health care as a right to its citizens. So that's an interesting fact. And as far as that goes, you can get offered, you can say, I'd really like to have some pasta with chicken parmesan tonight. And someone says, would you like to have a ham or a turkey sandwich? And you get offered the same thing again and again, and eventually you're negotiating whether you want mustard on your ham sandwich or not. Don't let them set the boundaries of the debate. The debate is single payer. I'm all for fighting for the ACA. I organized the ACA rally to keep that in place. It's a great step in the right direction. I'm super proud of the Democrats for how hard they fought for health care, making it more accessible to everyone. But last Sunday, we were at a rally for a single payer, and I would like you guys to all get involved with the Campaign for New York Health. Our senator, it's already passed the state assembly, a plan for the Campaign for New York Health. The New York Health Act is a statewide initiative that's being taken to provide single payer here in New York State. Senator Dave Valesky has recently joined the campaign and agreed to sponsor the bill. So we give it up for Senator Valesky for agreeing to join with us. We're only about 5 senators short from getting it passed at a statewide level. So if you'd like to get involved, look up Campaign for New York Health, look up the New York Health Act, and take up the fight with that as well. While we're preserving the ACA, I think that's the battlegrounds we have to be fighting right now, is focusing on the ACA. But while we're doing that, we also have the time to reach out to Campaign for New York Health and push for a single payer system that would help us all. Thank you all so much for coming out. We really appreciate it. Thanks to all the speakers for coming out, and thank you guys for caring. We do this every Tuesday for a few more weeks here at the Trump Tuesday, so please come down and keep up the resistance.